growing focus on good mental well-being in workplaces, many companies, they have started to take steps in creating this healthier environment for their employees. In fact, today we have a very special guest with us from Dutch Shell PLC, who is here to share with us more on how companies, you can create this healthier environment for everyone. Be it your employees, your customers, your partners, your suppliers, where all can feel valued and respected. So please join me to warmly welcome my guest for today. Hello, welcome Ms Lyn Lee, Chief Diversity and Inclusion Officer, Dutch Shell PLC. Lyn, thank you for joining us here at the event here.
Well, thanks for having me, Jacqueline, and good morning to all of you.
Absolutely. Lyn, Shell is one of the most diverse and inclusive organizations in the world, and you have driven many of the well-being initiatives. So today, really wanted to hear your perspectives on workplace mental health landscape, the initiatives that Shell has embarked on, and also your personal passion behind this topic. Perhaps let's kick off with this question. Now, you once shared in your interview that the irony is that when there is diversity, some groups will still continue to get excluded, some groups included, of course. Your team's job is to create a culture where it is safe for different people with different points of view that, in spite of those differences, are able to work in harmony. So tell us a bit, how is Shell creating this inclusive culture?
Well, so indeed, our first basis is that people are different. So in terms of mental well-being and mental health, our key focus, one of the key focus areas for us in our D&I area is on enabling and empowering. So if you look at that, what are the two things that we care about at Shell? It is about the diversity of our workforce, and the second one is really around how do we look at the enablers and the blockers of these diverse workforce, and how do we actually help people to thrive and to perform at their best.
I love how you use the word care again. It came out with, of course, Mr. Zaki when he spoke about our care award. Dr. Janil mentioned about needing to care, and you touching on care. So tell us, what does caring for your employees mean at Shell, and how do you action that?
So I'll talk at level in terms of our strategy, and of course then a few examples. Care is important because when we talk about business, the last thing we think about is the human part of it. Yeah, we think about the revenue and the numbers and performance, but at the end of this, people drive the business.
Absolutely.
So the care bit is around taking time, I think starting with the line managers, with the leaders, to pause and think and ask people how they are feeling.
Oh, I think with great intentions, every one of us want to do that. Many a times when I'm speaking to these line managers, they say, Jack, but how do I do it? I've got so much pressure, there's no time, What do you think? What's the business case of making time?
Well, so the business case of mental well-being. So let me just go back a few steps. Yeah, when we talk about care in a company, what do we think about? So in Shell, we've been on this journey on mental well-being since 2018. So we focus on three areas. We focus on reducing the stigma, on starting the conversations, and signposting resources. Yeah, and these things may seem overwhelming, but if you break it down, it is not so daunting. Yeah, reducing stigma means understanding and creating awareness around what well-being is and what mental illness could be, and what are the causes and the triggers. Yeah, so that would be one. And I think as well, if you're looking at support and resources, I think to think broadly around what it is that's available in the company. Yeah, and what it is that you can enable, sorry about that, enable, in terms of the simple things. Do you pause and ask people how they're doing and say your good morning and really mean it? Or, do you just brush aside all of this and get into work, right? Because you think that work is all about work. So I think that's the basis around starting and being human about this, and really caring about care, if that makes sense.
Absolutely, it absolutely makes sense, because it's easy to say that we care, but to have the intention behind to make sure that you do these little things of what you say, pause, it makes a world of difference. One of the key things that we know that Shell is doing so well is the stories that we've been hearing coming out of Shells, the impact on your people. Perhaps, if we can come to you to share, what were some of the initiatives that Shell kicked off in terms of well-being and the stories of the impact on your people?
So around the three things that I've spoken about, we've launched 3 initiatives since 2018. The first one is an initiative called I'm Not Okay. And it sounds a bit funny. I felt at first as well that it's funny that you have a campaign that says I'm not okay. Yeah, but it's really around that. Yeah, it is calling out the stigma and normalizing it. Yeah, and giving people the platform to be able to talk about the times when they're not okay. The second thing which we launched in 2019 was this thing called the One Thing Wall. And it was really a virtual wall for anyone, leaders, employees, contractors that we have, to write their stories about, be it their mental health challenges or things in which have helped them to go through and ride through a rough time. Yeah, so it's about storytelling, and it's a safe space. And I think that has created actually a lot of opportunities for people to feel like they're able to tell their stories, and also to not feel exposed, because they know that it's confidential. And then the third thing which we launched last year was the Care for Self pack. Yeah, and I really like that because again, it feels perhaps selfish when you talk about caring for self. Because many times, especially in Asia, in Singapore, we're taught to care about everyone else, right? But ourselves. So this is really about looking in and focusing and centering and thinking about all the things that you need to do for yourself. Because if you don't take care of yourself, you're definitely not in a position to take care of other people.
Absolutely right. What a great reminder there. Because you're right, we do forget, right? We're busying with different things that's happening around us. We're caring for everyone, be it family, be it your team members, that you forget to care for yourself. Maybe let me twist it and ask you first, how do you care for yourself?
Well, I'll have to admit that it's never easy.
Yes, always a juggling act because you're a mom as well, right? Because
Exactly.
I feel like, how do I balance everything?
Correct. So I think the first thing around care for self, at least for me, I remind myself about being kind. Yeah. So again, in the way that you want to be kind to other people, pause and think about what kindness means for yourself. Does it mean that you sit down and properly have that cup of coffee in the morning? Or does it mean that downtime, it could be 30 minutes of just being on your own and not feeling like you should be guilty because you should be cooking dinner or doing other things. So it's small little things like that, being able to acknowledge and be able to empower yourself, and to just take that moment out. So for me, that's very important.
Absolutely. You are right, we are a culture where we almost equivalent, productivity is key, right? We need to always be productive. Almost taking that time to enjoy that cup of coffee is like, oh, is that an indulgence? But no, because self-care is important. Yes. You were sharing one of the initiatives that you had at Shell is this One Thing Wall. And I love this idea of using storytelling and people can share their stories because stories can inspire and encourage others as well. Were there any inspiring stories that came up when you were reading the One Piece War that really stuck with you?
Well, a few. And I think, perhaps before I talk about what inspired me, the feedback that we got. The first was around the leaders that shared on that One Thing Wall. And it was a huge encouragement for staff and employees who saw their leader or someone that they look up to and thought, wow, I never knew. And the first thing that people think about is always so brave and so courageous. Yeah, so I think that's really stuck with people. What really resonated with me as well is the many stories of high performers, who kept going and who felt that they had to give, and one day, everything just went down, right? Physically, mentally. And it was a sobering reminder in terms of how even the best of us, could sometimes feel the challenge of mental health. And it's a sobering reminder as well that all of us will have to go through good and bad times. And I think the last 2 years as well have made this real for many, many of us in terms of the pandemic and in terms of the different situations we all have to go through. So that really stuck with me.
Yeah. Leaders, being able to share their stories, not always having to look like, oh, I know exactly what I'm doing, I can manage all the struggles, the challenges. They walk the talk if we want to create this safe culture, this safety and environment to talk and normalize these conversations about mental well-being. In terms of normalizing these conversations around mental well-being in the workplaces, what do you think we are doing right in the Singapore context, and what else can we do more of?
Well, I'm really encouraged that we have campaigns like this, as well as the playbook, because the first thing is around creating awareness and the engagement around this. So that's number one. One of the reasons why mental health and mental illness is not talked about is because it's a stigma. Right? It highlights our weakness, it spotlights on our vulnerabilities, and because it's not understood, many people would feel like it is not okay to speak about this. So I think one of the things that we're doing well, and I really would encourage for all of us to do more of, is to create that awareness and understanding.
Can you give us some insights, from your experiences? What are the contributing factors to these mental health stigmas, and what can we do as an organization to counterbalance these effects?
So as I mentioned, mental illness is a stigma because it really does highlight our weakness. Unlike physical illness, it is very hard to pinpoint. So sometimes you don't know where's the beginning of your mental health struggles. And it gets more and more overwhelming. And I think thirdly, mental health will definitely impact performance at work. So therefore, if you see this as a personal weakness and it's hard to express and pinpoint where it is and how you feel, and on top of that, you're struggling with performance, then it's definitely something which people feel uneasy about, and struggle with. So a few things that we encourage and we try, and to encourage our staff to do, and leaders as well, is firstly to make sure that we take time out, as I mentioned, to talk about this, to normalize this. So in many of our meetings in Shell, we start with a safety moment.
Oh, tell us a bit more. What is the safety moment about?
Right. Well, it started with physical safety, right? Just talking about making sure that you're safe, that you're not driving. If you're driving, get off the call. And what we've done.
These days, there are so many people that I'm driving.
No. So this is a no for us, right? If you're on a call and you're driving, get off the call, because we want for you to be safe.
Yes.
So in the same way, we now talk about the safety moment as well in terms of psychological safety. And we ask people how they're doing. Are they doing well? What is it that they are concerned about? And it is also then an opportunity for people to feel free to express or not to express. But what we do in that is to create the environment where it is okay to talk about these matters, and it's okay to share about your struggles. And it's fine as well if you're working from home that you feel overwhelmed because you are multitasking, you're doing work and doing caregiving, activities. So we normalize that. And I think more importantly, as I said before, right, it is for the chance for the line manager to pause and really listen. Because when you do that day in, day out, and you normalize it, when there is an emergency and a mental health crisis for anyone, the trust is built and the safety is there, and people will feel more inclined, and probably, a higher chance that people would reach out and ask for help.
Absolutely. I've always enjoyed and really latched on to this idea of psychological safety, coined by Amy Edmondson. And the thing is, safety, physical safety, we all tend to be very aware of it because we can see.
Yes.
It's the emotional, the mental, the unseen, the invisible safety that we also need to consider in crafting. Now, we have, lived through the pandemic and still living through. So the way of how workplaces are operating is starting to shift as well. What are you seeing as how we can continually create the safety to speak up, to talk about mental well-being? You know, both be it remote working, going back to hybrid, and maybe one day we might go fully back to face-to-face. What is the shifts that you're seeing happening?
Yeah, and that goes back to the beginning of what we've said around inclusion. So it's to recognize that people do not feel safe unless they feel included and unless they feel a sense of belonging. So, you know, it's all intertwined. And when you think about work, and where we are today. And maybe 1.5 years ago, just the whole idea of spending most of your time working from home is remote to many people.
Shocking.
Yeah, yeah. But we also have to recognize that there are many of us who are in jobs where you cannot work from home, and you don't have that choice, right? So I think it's to recognize that the situation that we're in is different things to different people. So what I want to add around psychological safety as well is to recognize that we are all in different situations and that we have a different starting point. So, you know, going along in terms of mental well-being as well is worker welfare, right? To make sure that things around, just very simple things around work environment, you know, working conditions, that those are taken care of, because those contribute as well to mental well-being and employee well-being. So I would say, you know, to your question around hybrid working, you know, do we go back, do we not? That as we talk about one group where most of us can work from home, let's not forget about the frontliners, people in operations who do not have the opportunity and may feel like they're being excluded in this conversation.
Different situation, different starting point, as you're mentioning that, requires us to dig into the empathy piece, isn't it? It's just not making the assumption that everyone is starting on that same 100-meter dash line, but how we can have different starting points as well. We talked a bit about leadership, how they can walk the walk, you know, and share their own stories. How about if I'm a co-worker? Because peer support is also really important. You know, sometimes, well, in the past, you know, we used to say that we spent more time with our colleagues than we do with our family members because we spent about 8 hours.
We're married to our jobs.
We are married to our jobs, absolutely. How can co-workers then, you know, if some of our audience member, they're thinking that, hey, I'm a co-worker, I am sensing, noticing that perhaps my fellow peer is starting to struggle, you know, I guess a couple of questions here. One is what should we look out for? And if we notice that, what can we do?
So I mentioned around awareness. I think the second thing to highlight as well, two other things I want to highlight is around motivation. Yeah, so I spoke about care for self, and that's motivation to take care of yourself. When it comes to caring for others, the starting point is around resources. So for companies to make sure that you have the basic resources in place. So in Shell, one of the early things that we did was to train care champions.
Okay.
Yes, and that is, so I want to qualify that care champions are not professionals. Yeah, but care champions are the ones who have been trained around empathy and to train on looking out for signals. Yeah, so what are signals? Maybe someone, a colleague that you know who seems to be different, yeah, who maybe is not talking as much, or as with the video, you know, with that dark cloud.
Dark cloud,
yeah.
Which actually, you know, with the video is visible, but sometimes it's not.
That's right. So I think care champions are trained in terms of noticing small things, and in Shell as well, the physical aspect around, you know, noticing small things that you should intervene, yeah, before it becomes bigger things. Yeah, so that's one, care champions. I think the second one as well is the intervention. So we also talk about allyship, yeah, in terms of the conscious inclusion. So you could be inclusive by making sure that you don't pass bad remarks about other people, but conscious inclusion is about taking action. Yeah, it is about noticing and intervening by asking someone how they're doing, asking them what help do they need, sometimes and many times even before they know that they need help. Yeah, so I think this is one of the very small things. And if you're a smaller company, if you're SME, you don't have to do this on your own, because there are companies, that are focused on this. There's also employee assistance plans. Yeah, there's SOS. There are many of these resources where they're equipped to train as well, employees on just basic skills, on being a care champion.
Great. And yes, we will be sharing more resources later at the tail end of our event here today as well. I love this idea of care champions. Sometimes, the piece about helping others, looking out for others, it also changes you. Yes. On the inside. What were some of the stories, the impact that the care champions themselves experienced?
Well, I think the first thing is always around pausing. I've spoken a lot about pause today.
Yeah, because pausing is not as easy as it seems. Conceptually, everybody's like, why so difficult?
Yes.
How difficult it is to pause? Try, okay? In your next conversation, before you reply someone, just pause 5 seconds.
5 seconds.
5
that's
seconds,
right.
and see how challenging that is.
Yes. So it's around the act of pausing. Yeah, and slowing down so you can notice someone else. Yeah. So I think that has been impactful. I think the second one, which always empowers me, is the passion of someone who is trained as a care champion, because they suddenly feel that they are able to help someone else. They're able to take a positive action. Yeah, because when we talk about mental well-being and talking about all of us caring for ourselves and all of us wanting to be well so that we can be good at work, sometimes it's hard to understand what this means. Yeah, and what is it that I have to do so that I can be well or someone else can be well. So it's small things, right? It is what I'll call little habits. So if you know that you have a bad habit, then you would try to replace that with a good habit. So one of the suggestions that I have for all of you who's tuning in now is to maybe think about that one thing that you do to pause and try that as a micro habit every day.
I do a lot of work as well in the space of DEI and working with executives, right? One physical thing we've done is really taking a cup of water, pause, drink. That action of drinking forces you to start shifting.
Yes.
Your habits. What is your habit? When you started to include pauses in your conversation, what did you do?
Let me talk about not the conversations, but emails. How if you're busy at work and you go from one email to another. So a trick that I've learned from a previous boss of mine is, if you really get excited, and we all have those emails where we get really upset about and we just want to respond.
Kaboosh! Explode!
So 2 things that I do now: write the email, but don't send it. Write the email, walk away, come back and read it again, and see whether it's the right thing that you want to say and whether it's something which will impact you positively or negatively. So that's one around emails. I think in terms of listening, for me it's taking a deep breath, because we run from call to call, meeting to meeting, and this is my typical work day. From meeting to meeting to meeting, and long hours.
Yeah.
So I find that sometimes I don't breathe. And taking that deep breath actually helps me to pause. And it doesn't take a lot of effort. It's much more in terms of reminding to say, take that deep breath, walk away, and come back.
The intentional,
Yes.
posture of slowing down. You spoke about passion of your care champions. And clearly, as I spoke to Lynn, before we started and during the session as well, you are very passionate about this topic. Perhaps share with us, what drives, what motivates your passion, and why is mental well-being important to you?
Well, so let's always start with the beginning. Yeah?
Yes,
So a personal story.
Once upon a time.
I won't bore all of you. Well, it is important for me personally because, like many of you, like many of us, I've gone through my own mental health challenges through the years, and I know as well through all these what my triggers are. And it's important for me now because I act on those triggers. Yeah, I know where potentially it could get a lot worse for me. And number one is about caring for self. And when I feel like things are getting bad, one of the most important thing for me is actually physical exercise. Yeah, just working out. That helps me. But the more important thing is the kindness to myself. Yeah, and why is this topic so important for me? Because I've seen how devastating it has been as well for loved ones, for friends that I care about. Yeah, and this includes some very serious emergencies. Yeah, and when you're in that situation as well, personally for me, when you get to a day where you find that you have trouble getting out of bed, yeah, then it suddenly dawns on you the importance of mental health and well-being. And I have to say, I think many people would see me as a high achiever, right? A perfectionist.
I mean,
yeah?
absolutely.
Yeah, and that's all I can say, that you cannot have that, you cannot thrive, you cannot perform if you don't take time out to just notice what it is that we could be doing to our body by not taking care, right? And that simple act as well of intervening to help someone else, to ask the person, would you like some time out? Yeah, or would you like to pause? Because work is not everything. Yeah, health is everything, and being mentally well is everything, because it enables you to do all the other things that you think you can do. So I'm passionate about this because I've lived the experience. I've seen as well people who have realized the importance and are thriving and are happy, just like me. Yeah, so I really would like to advocate and say, take time out. This is an important topic. I'm really glad that we're talking about this. Yeah, and I'm really, really glad that as a country and as many companies, we're coming together to have a voice for this, and for all the leaders out there who are wondering what it is that I can do. It is very simple. Yeah, just reach out. Reach out. Think of one person that you can ask today, how are you doing, and what can I do to help? Yeah, that will make a difference.
Reach out with a question. Just ask that curious question to that individual.
Exactly.
How
right.
are you doing? What support do you need?
Yes, and I think I want to emphasize what you've just said. Ask that curious question, but really be curious. Don't ask because you were asked to ask that question.
Checklist. Okay, tick, 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 tick. We need to finish that checklist.
Yes.
Yeah, the intention of curiosity, right? And not trying to problem solve. A lot of managers, because how we are brought up in a way that we are trained to solution, sometimes that asking becomes interrogation.
Exactly.
How are you doing today? What's what you need?
And this interrogation, and I find myself guilty of that, not so much at work, but at home. Yeah.
I'm going to silently raise my hand up at this point as well.
Yes, at home, because I'm a single parent and I'm always in action, right? If my daughters ask for help or if they have a problem, I go into problem-solving mode. Yeah, and many times when someone's in distress, the last thing they need or want at that point in time is a solution. The most important thing is someone who will listen them out. Yeah, so that's the most important.
Being present.
Correct.
Beside them.
Yes.
Right? And that's the piece about empathy, right? Just sitting beside that person. If you need my help, lean.
That's right.
On me. We are coming to the tail end of our time with you, and we've got some wonderful insights already. We really wanted to think about some action points, because many of the companies, organizations, employers, they could be at the start of this journey on how can we tackle mental well-being. What are some of your suggestions? Because it's not about just having initiatives, it's about having sustainable mental well-being initiatives within the organization. What perhaps top 3 tips that you have?
Yes, well, I did mention that it would be 3 tips. I would want to give 4 tips.
The more the merrier.
Yeah, well, I'll start with what I've said throughout this discussion, that the first tip is around the line manager stepping up and showing curiosity and empathy. That's the first. I think on a serious note, the 3 tips for companies if you're starting out, the first is to work on awareness and understanding. Yeah, that is key and that's critical, because that will enable the organization and people to feel safe if you have common knowledge and you have common understanding. I think the second one is motivation. Yeah, because mental health and well-being doesn't have to be all gloomy and dark clouds. It can be the positive things around well-being, about resilience, about making sure that you keep fit physically, mentally, socially, especially when we're all feeling a bit isolated. Yeah, and all these things are motivation around helping people have the spectrum of what it means to be well. Yeah, and as I said as well, working conditions. If in your organization as well, it means that you have staff who have dormitories, etc. Yeah, take care of those things. And I think the last is around resources. Yeah, so I've seen as well that there's a playbook and many resources, and these are all available for all of us to use. Please make sure that you use them. So I think these are the three things, plus the line manager empowering and enabling, and I think it will make a difference.
Okay, thank you for that. Very practical tips on what we can do. Now, I'm going to get greedy. I've got one extra question.
Yes.
Buyin. You being in leadership position, being the Chief Diversity and Inclusion Officer, how do you get the buy-in of your people? Because sometimes on the top, right, as leaders, as employers, we want to kick off. But at the end of the day, it still becomes something that's just conceptual right at the top if it doesn't cascade down. So what are your suggestions then to our employers joining us on the call today? What are some of the ways that we can buy in?
I have no easy answer, unfortunately. It's hard work.
Okay, how hard?
Well, hard work meaning that you have to really want to do this, to sustain this. This is not about a policy that someone else has asked you to implement. Yeah, it will fail from the start. I think the second one is hard work because it is about trust. Nobody will come out to you, even if all the senior leaders, and top management line up, nobody will come out to you if they feel like they are going to be penalized for asking for help. Yeah, so I think one of these things around psychological safety is the fact that you do want to make sure that whatever information that is said and shared with you remains confidential. This is key, and this helps to build trust. It's hard work as well because it is a long journey. Yeah, you cannot dictate that somebody will trust you. Yeah, but you can break that trust easily. Yeah, so from that point of view, I think it is about making sure that there's role modeling, storytelling, leaders talking about their own journeys, helping people to also talk about themselves. And it doesn't always have to be your personal mental health journey, but your loved ones, your colleagues, and what it is that you do together. And I think to end off, right, in terms of then the hard work that can be fun as well, is to build resilience, right? To make this normal, to make taking time out normal, and to celebrate those good moments together, because it builds that bond, and it makes for that time, that certain period of time when there's a crisis that calls out for it, that you will suddenly realize that people are ready. Yeah, so I hope that helps. I mean, it's not the perfect answer. I'm not sure if it's a response that people are looking for.
We're not striving for perfection, right? That's what we talk about. We're not striving for perfection.
Exactly right. Yeah. So in this space as well, I think maybe just to highlight what Jacqueline and I talked about, that it is also a stigma because many of us have the mental model of perfection. Yeah, when it comes to our performance, we think about the time at year end when we get our bonus, where we're told that you've done a great job, right? Not just a good job, but the best job.
Yeah, I mean, meeting expectations is just average these days.
Average, right? So we all would want to exceed performance. But that brings with it a toll, on us in terms of our own expectations. So actually, many of us, while we have that mental model, we actually operate from an imperfect model, right? We all are imperfect, we all are slightly broken, and if we think about it that way, I think it will help all of us much more.
It helps us to reframe, as we move forward. Yeah, and I'm going to end off with, something that you said, be kind. to ourselves. That's what we can do for ourselves and for each other. Well, that's all the time we have today. Thank you once again, Lyn, for joining us, giving us these wonderful perspective, insights, and your experiences at Shell.